Hi, everybody. Welcome to the Alzheimer's Association's Facebook Live here at the end of April. I'm Dr. Elizabeth Edgerly, Executive Director for the Alzheimer's Association. And it's a wonderful time of year to gather, and I'm so happy to be gathering here today, virtually at least, with two of our amazing volunteers and champions for the cause, Jean Giramonti, Latrice Brown. Thank you for joining me. I know we've got a lot to talk about. We have just returned from Washington, D.C. not too long ago, where dozens of us gathered. Actually, there were, Latrice was there as well. There were over, I think, 1,500 advocates from all over the country, the largest since the pandemic, who came to represent all of you who are watching us, and all those that we care about, not only in our community in Northern California and Northern Nevada, but across the whole country. All these individuals came and told their stories and advocated for positive change, not only for their loved ones now, but for future generations. So I'm really excited to share a little bit more about that. Latrice is going to tell us a bit about her experience. But today we're really excited because this is a special week. It is Volunteer Appreciation Week. And so, of course, we had to have two of our amazing volunteers who represent multiple activities with the association, not just one, right? They represent advocacy programs, education, care and support, fundraising. We are so grateful to our volunteers year-round, but especially this week. And so let me start by introducing our two guests. We have Jean Giramonti, and Jean has been volunteering with the Alzheimer's Association for over a decade, and we're going to hear more about Jean's story in a little bit. Welcome, Jean. Glad to have you here. He's also on our chapter board, by the way. And Latrice Brown, who first came to us through the Walk to End Alzheimer's, and Latrice was with me and all those advocates at the Public Policy Forum, the Advocacy Forum, a couple of weeks ago. Latrice, welcome.
Thank you. Thank you very much. Awesome.
I'm so glad that you're both here. Jean, why don't we start with you? You are one of those volunteers who gets involved in lots of things. I know that you're also extremely involved as an educator, a community educator, providing the classes that we do, including the financial management class. So what keeps you motivated as a volunteer? How does this gig work out for you?
Oh, well, thank you, Elizabeth. I'm glad to join you and Latrice, and welcome everybody. Yeah, it was a real easy choice for me to become a volunteer for the Alzheimer's Association, in particular, delivering educational programs to various community groups of all kinds. And this all started because I was a user of the Alzheimer's Association support and services when I was the primary caregiver for my late husband, Art, who was diagnosed with both Alzheimer's dementia and vascular dementia. And the association really was a lifeline for us, for me in particular as a caregiver, being part of support groups and then slowly becoming more engaged with the associations, sitting on panels for communities to learn more about what the association did. So for me, after Art passed away in 2018, and after I retired, it was an easy choice to want to do something meaningful in this arena. And the association provided such a great opportunity for me to get out into the community and talk to various groups, spread the word that the association is available to support families and those diagnosed with the disease. So I am particularly proud of the fact that I have been able to carve out a little bit of a niche within the LGBTQ community by doing a few specialized programs for various groups, especially up here in the North Bay where I live, up in Sonoma and Marin County area. So it led ultimately to a spot as a member on the chapter board. So that allows me to interact with the leadership of the chapter. And I'm very proud that I'm able to participate in some of those leadership activities as well. So yes, I'll just quickly say the Managing Money program is an excellent program. I really enjoy delivering that one because it's very specific to tips for families and caregivers on handling those difficult and complex matters with money and some legal issues. So, yes.
That's awesome, Jean. That class and that content is so important. Sometimes you don't know what you need until you're knee deep in it, right? In terms of struggling with some of those things on how to make sure finances are taken care of and the person is also safe in terms of financial issues.
Absolutely.
It's tough. Jean, I wanted to ask you something. One of the things that I've found that when I've been involved in different activities, not just as a staff member at the association, but as a fundraiser, I find it to be therapeutic. Like it helps me feel like I'm doing something, not only in memory of my mom, but to help change this situation. How is that for you when you're doing education and these other activities? Do you find that it's kind of a positive healing experience?
Oh, absolutely. I mean, I'm a bike rider, and so every year for the longest day, which I wear the shirt here on June 20th, this year is the summer solstice. And that's when we use the symbolism of the most light to shine on this disease and what we can do to improve. So I get very motivated by my bike riding, and I'm able to combine. And I'll just say, I started riding my bike after many years. I hadn't ridden my bike since my college days, but as a means of reducing my caregiver stress during the worst part of that journey is when I began to ride my bike, because for me, that was a way to start taking care of myself. We always hear as a caregiver, take care of yourself too. Well, that's easier said than done. So my bike riding is now combined with my annual fundraising. I get to meet people along the routes that I take, and I'm able to spread the word not only on
there
the
you
bike.
are.
Yeah, that was down on the Central Coast this past summer. So, when I'm riding my bike, even on my normal weekly rides, I often think very deeply about who I'm honoring, namely my late husband, but all those facing this disease. As an educator in the community, I hear all kinds of stories. So that's what keeps me centered on the purpose of what we're doing.
Awesome. Thank you. I know I jumped ahead a little bit, but I was thinking about how sometimes it all brings it back together when you volunteer too, so thank you for that. Latrice, I know Jean was just talking about caregiver stress, and I think you've had your own share of challenges. Latrice was recently featured in one of our blogs about her and her mom's journey with Alzheimer's. And one of the things that we outlined there, that thank you for sharing with us, was the challenge around even just getting a diagnosis, let alone, getting the kind of care and support you need. Can you share with us how did you come to the association and end up in these roles that you're in?
Absolutely. Thank you so much, Elizabeth. It's so wonderful to be here with you and Jean. And thank you so much for featuring and talking about this for my mom. When we first started to get a diagnosis, we have a diagnosis of vascular dementia now, but that took us 5 years to get. In East Contra Costa County, my mom's primary physician was prescribing her the memantine and Aricept cocktail. I like to refer to the dementia cocktail because they were prescribing it with no diagnosis for it. So when I began to go to the doctor with her, I asked them why they were prescribing that. And they were like, well, your mom said she had some memory issues or some cognitive issues. And they just started prescribing it. So I had to start the process of getting a referral to a neurologist because she had a PPO at the time. So I had to get a referral to a neurologist. And in East Contra Costa County, there's not a whole lot of neurologists just floating around. They're just not really here. So when I was finally able to find one, he was close to retirement, but he also, there were no tests really ordered. There were no brain scans or anything like that ordered. And he kind of did a verbal test with her and was like, well, I think she's okay. She was not okay. And then 5 years from that point, she kind of up and had kind of an odyssey across the Bay Area where she got in her car and she drove across most of all the bridges in the Bay Area and was going to work apparently. And so we found her 30 hours later wandering on the street in San Francisco. And
my gosh, you must have been terrified.
It was terrifying because I had to become a lot of things I hadn't been in that moment. I had to become kind of a hacker and figure out a detective and figure out where she might be and follow her debit card and things like that to find her. And so finally, when she ends up in the hospital after that, a young doctor, and bless his heart, he says, well, duh, she has vascular dementia. And I'm like, oh,
wait, what?
Yeah, I'm like, oh, you don't say. So then we began the process really of caring for her in that situation. I've since switched her to an HMO, so at least everything is kind of all in-house. They can refer a lot easier. They might have more neurologists available than doing it outpatient style the way we were doing it before.
Having to find your own provider is so hard.
Right, which is difficult, and I felt bad for at the time dragging her around to doctor after doctor, trying to get this diagnosis. But I coming upon the Alzheimer's Foundation was actually a super helpful beacon of hope for me. My sister-in-law works in hospice and often attends events like the walk and other events where Alzheimer's Foundation is. And I was introduced to the foundation through that walk, and I saw there was an advocacy tent, and I liked the idea of being able to help at kind of a higher level. Maybe we can help everybody. Like it may not be fast enough to have helped us through that, but anybody coming behind me, I would love to help if possible so that they don't have the same frustrations.
I love that. Yeah, I do think that public policy and advocacy work of the Alzheimer's Association it's amazing because like what you're doing now, Latrice, is you may help to get bills put in place that will help millions of people. It's amazing, and they'll never know that you had anything to do with it, right? But you'll know that you did it. And so and actually we had some pretty major bills in Washington DC this year, really important for the work of the association. So thank you for doing that work and for sharing your story and what you've gone through, both of you, because there's so much power in your story to move those around you, and in particular legislators, because they're going to remember your story about your struggle to get a diagnosis for your mom, and they might even steal it and start telling other people about their constituent who had this experience. So really appreciate you talking about that. Is there more that you want to share about kind of what it was like to navigate the healthcare system? I know a little bit about your background, that you've got, you've got stuff going on. You know how to work. You work for the state of California. You know how a big system can sometimes work. How did you manage this for your mom?
It was somewhat, it's very bureaucratic, but stacked on top of that is just a real lack of training and knowledge in these areas. So it, aside from having to, especially in a PPO situation where you have to get referrals and you have to navigate finding the physicians yourself and then going to see the physicians. And then if they don't work out, you have to get another referral and start all over again from the beginning. And if you don't have a primary physician that understands the need for these issues or understands that there might be a dementia or an Alzheimer's diagnosis, that maybe they need to refer people to them. It is very much like being on the outside, kind of beating your head against the wall, because it's different than if this were your child. You have more control over the situation as as a child, but taking care of someone who's already an established adult is in coming in to take over their healthcare and then navigate them through a system that doesn't understand that they need help or care, or the specialized help or care that they need to provide. So I understand, working for a state government myself, I do understand the layers of bureaucracy and red tape of various things. You need 3 forms for this and 4 forms for that. But some of the orders of things, like you need a diagnosis before you can get something done, or before you can get a referral to go and have things done, is really very maddening. And it would be helpful if there was somebody to hold your hand, maybe a little bit. And social workers in hospitals, they try, and bless them. But if you're also in a certain financial bracket, which that bracket is in the middle, so you're not poor and you're not wealthy enough to pay for everything out of your own pocket, then that also creates
massive strain, which I am sure that people who are viewing this, whether you're viewing it live right now or you view it at a later time, people will relate to that. I know my family was in that, where my mom didn't really have enough to cover, and although she did actually qualify for Medicaid, it was a very different situation in Maine. They paid for assisted living. That's not true in California unless you get a waiver, right? But even what you're describing, Latrice, it really resonates with me in my experience where, and Jean, I'm curious if it was that way for you with Art, but I felt like I had to I am kind of an expert, right? And yet I thought, wow, this is really hard. And it felt like it was hard every step of the way in the system, like not just the disease, but the system was really hard. You felt that too, Jean?
Well, I have a little more positive story. So,
yay!
For contrast purposes, while I hear from a lot of our constituents the same sort of challenges that Latrice and you've just described, we were fortunate to have a pretty long relationship with our primary care physician, and she took a particular special interest in her practice of her older adults. While she was not a geriatrician, she recognized some of the signs even as I was recognizing them. So we began a conversation pretty early on. We got referrals to a neurologist at the appropriate time, and then she was there to help. So it's possible. Yeah,
it does happen.
That, that's a good model.
And what a difference it makes. So actually, I know we're bopping around a little bit here, but some of the, and we're going to come back, Latrice, I want to come back to this, because when you were in DC, this was actually part of the topic of conversation, right? But let's hold that. I want to, Jean, I want to go back for a sec and talk. You mentioned pulling out that bike and getting on it, both for your own well-being and to kind of manage the stress of being a caregiver. And you also have been a superstar in raising money. Yeah, you are, for the longest day. Can you talk a little bit more about that and what that experience has been like? And if you have any advice for those of us who are getting ready to do something for the longest day.
Well, the great thing, thanks. Yeah, the great thing about the longest day is that it's wide open to whatever creative ideas you have to spend that day or that week, and it doesn't even have to be on the actual day. You can start it, anywhere during the season here. But for me, it was a simple task of just notifying everybody from my professional years, my contacts in that network, my family, my friends, and as many people. And each year I add more people to my distribution list. And I simply, I take the easy way and just notify everybody of the importance of this cause and why I'm engaged in it. I tell my story briefly each year to remind people why I do this. And I have proudly, increased my level of donations every year that go directly to the Alzheimer's Association. So and I told everybody when I became a volunteer that my least favorite thing to do is fundraise, because I literally don't like asking people for money. It's just not in my makeup. But now I realize, boy, when you ask people, they respond. And, so it benefits me personally because I'm enjoying this beautiful scenery that I find in my destinations. I have time to really contemplate the purpose of my rides. I meet people along the way that I can spread the word. So being a volunteer, selfishly is something that is so rewarding. I think, Latrice, you probably feel the same way. And it's just, it's a back and forth. I mean, I'm serving the needs of people because I've had that experience, and it's my desire to help those navigate their way through a really tough time in their lives. But it makes me feel good that I'm doing that. And, that's just an easy way to say why I enjoy my role.
I love it. Latrice, you were reacting.
Absolutely. I agree 100%. It's an excellent way to give back and to just help so many more people. And it's amazing.
Yeah. Oh, good. Jean, I know you mentioned, it's not maybe your favorite thing to ask for money. It's really interesting though, because it does feel good when people give though.
Oh, yeah.
It's like, oh, they gave. And one of the things I've come to, because I maybe started off more like you, and now I've obviously I do it a lot, but and inviting people to join, because a lot of people can't volunteer, don't have the ability to volunteer. Maybe they're not going to ride their bike like you are all over, but to even be able to be a part of it by supporting you feels like you're part of it, because you are part of it, right? So thank you for letting people support you in that and asking them and inviting them, because I think it feels good for them too, to know that they are making a difference. Latrice, I did want to go back, because this was your first time going with us to Washington, D.C., right?
Yes.
How was the experience? Like, what did you think?
It was an amazing experience. These are definitely my people. I've never been with such a group of people who were all focused on the same thing, trying to lessen the impact for those that they love and trying to lessen the impact for people coming behind them. It was wonderful and fantastic to be surrounded by a group. It was so much empathetic, all the loves, all the feels there. It was all of it, and it was great. People who really actually understand what you're going through. They understand what's needed. It was a great time, and to also speak with legislators and to tell them our story, and remember that our legislators do work for us, and they do listen to us, and we need to tell them what's happening for them to work for us, right?
So you actually got to meet with Representative Garamendi.
Yes. Very, very nice man. Very tall.
He looks tall.
Yeah, really.
That is fantastic. I know when I first started doing some public policy visits, advocacy visits, I was a little nervous. Now this was a long time ago, but I'm not as nervous anymore. How was that for you? Did you feel like the Alzheimer's Association prepared you for that meeting?
Yes, I was nervous because I'm very much I'm very much kind of a political junkie. I'm very into that just because. And then, but I felt like all of the training leading up to it from the Alzheimer's Association was a wonderful preparation for it.
Oh, good, good.
I was nervous just because I was nervous, not because I wasn't prepared.
Yeah, yeah, yeah. It's excitement, isn't it? It is.
Hmm.
But for those of you who are thinking about volunteering, and if you're like, ooh, maybe that's what I want to do, I think that the training that our advocates receive is fantastic. And you learned before you even went, what are the things that we're going to be asking for, and the materials are really well done. So let me just say, don't be scared. And would you agree? I mean, with any of these volunteer opportunities, there's support behind you.
There's so much support for it, for anything, and everything is a great idea, and nobody shoots down anything that you have to say, and you can't really do it wrong.
Right.
And that
You
was
can't.
really awesome.
Yeah, I think one of the themes was tell your story, right? Share your mom's story, share your story. Jean sharing your late husband's story, and I share my mom's story, and so it's so powerful. We are so lucky to have the two of you involved in the work of the Alzheimer's Association. I know I need to remind people we have Advocacy Day coming up. So if any of you on the call are like, I want to be like Latrice and I want to get involved in this, this is a great way to put your pinky toe in the water and join us May 7th in Sacramento for California Advocacy Day. If you're interested, reach out to us and we can see if we can still squeeze you in there. And if it doesn't work for this year, just know year round, we need advocates in both for the state government and for federal government. And we can always use more voices, more stories, more support. So Jean and Latrice, it's been a real pleasure to have you today. Again, thank you both for all that you do. I know you're busy people, and for you to take the time to support the Alzheimer's Association in this way means the world to us and to all these people that you're representing. So thank you. Thanks for being here.
Thank you.
Take care. And thank you
you.
all. We'll see you next month. Take care.